Good morning, I am Panganiban from Diasen and today I'm going to perform a care after the death body or the post-mortem care. And this is done so that the patient can be delivered to the funeral with respect and dignity as he or she have passed away. And this is also to prevent any disfigurement or tissue damaging and to prevent the rigor mortis. And the first step that I'm going to do is check the name tag or identify the client. Next is prepare all the necessary materials, the identification tags, linen, cotton or waterproof pad, bath blanket, fixed towel, basin with water, soap, and adhesive tapes, and also a plastic bag for the client's or the dead patient's belongings. The next step that we're going to do is put on gloves. As we are dealing with a dead body or a body that has expired, we need to wear gloves to ensure our safety for any blood splatter or any excretion that we may care for patient. The next step that we're going to do is respect the family religious restrictions regarding the care of the body, if possible. Assuming that this is the patient's chart, and I am checking whether there is a note, if there is a warning or note that I need to stop this because she is a Muslim or any other religious practice or beliefs that the patient is following. Also ask the family members, but as of now, or assuming right now, the family members said that they did not have any practice or restrictions. Next is place the body in a supine position. Place one pillow under the resident's head or beneath the client's head. Next is insert dentures if this is the facility policy and close the mouth. Close them up. Next is place the bath blanket over the bed and remove the top covers. Assuming that there is a top cover since I have a shortage of linen. And next is remove drainage tubes such as IV infusions, catheters, or anything that is inserted to the client's body. Since there are not any as observed, I will proceed to the next step. And the reason why we need to remove those are because we need to make the patient clean and neat, and that anything that is unnecessary or disturbance need to be removed. Next is cover draining wounds with clean dressing that is adequate to absorb any drainage. For example, this hand has a wound and that there is a drainage. I'm going to here. Assuming that I have a clip to close it. Next is clean the body as necessary. I'm just going to example how to clean it fast, just like in bed bath. The arm, the axilla, the hands, and then the other side. And then you need to also clean the legs, and the inner part, and the feet. That way, and comb the hair to make the client neat and presentable. Next is place a protective pad under the buttocks to collect any drainage. This is to collect any, once since the client is dead, yung mga particles or any liquid material, pwedeng tumulong na. Assuming that this is a water pad, turn the patient, you can actually push the patient back or turn it to the side. Here, and then turn the patient forward. Face it again. Next is when a ring is developed in the client's finger or ring finger or any jewelry in the hand, wrap it with adhesive tape or secure it with adhesive tape. Looking at it now. Assuming that the client is wearing a ring on her ring finger here, and clasp it or secure it with adhesive tape. Assuming that I have an adhesive tape. And then place it in the spot position again. Next is attach the identification tag on the client wrist or ankle. This. Next is put a clean hospital gown on the client and place the client on a comfortable looking position and wait until the family or relative is finished viewing the client, as it may be the last time that they will see the client in the institution or in the situation that allowed. Assuming that I have a clean hospital gown, I have the client here, here, remove it. Is wrap the body with linen, fold the upper portion down over the head and the lower portion over the feet, the near side away from you along the length of the body. And fasten and attach the name tag of the client. Assuming that this is a name tag, attach it here and attach it with a adhesive tape. Next is prepare a checklist for the belongings of the client, such like the jewelries or the watch or any important belonging of the client, like hair clips or like anything that is attached to the client. And place it all on the plastic bag or a bag that has a ziplock. This is to give to the family so that we can, of course, assure that there will be no issues regarding these belongings. Assuming that this is a client's belonging. And secure it with the ziplock. Next is, after that, you need to give the belongings to the immediate family and also record who received that belongings and what are the belongings listed in there. And after that, and after transferring the client to the mortuary, strip the bed and clean the room as per the facility policy and disinfect the room. Disinfect the room. Next is wash the hands and document the procedure.